All right, welcome. Today we are taking a deep dive into one of the most critical topics in nursing, infection control. We're going to break down a super dense chapter and turn it into a high-yield study guide that'll help you absolutely crush these concepts, not just for your exams, but for your entire career.
So, here's our game plan. We're starting with the absolute fundamentals. Then, we'll walk through the process of how an infection actually happens. After that, we'll cover how to recognize an infection, and most importantly, how to break that chain with precautions. And stick around to the end because we're going to wrap up with some killer NCLEX tips and a real-world scenario to put your brain to the test.
Okay, first things first. Let's get our definitions straight. What exactly are we talking about when we say infection? And what or who are we really up against? So here's the key takeaway. An infection isn't just a germ hanging out. It's about that germ, that pathogen, getting in and starting a domino effect inside the body that actually leads to disease. It's an active process.
And these are the main culprits, kind of like the most wanted list. You've got your common bacteria and viruses, which we hear about all the time, but don't forget about fungi, those weird things called prions, and of course, parasites. Knowing the different types is huge because they all play by different rules. Now, how does our body fight back? I love this slide because it breaks down our two defense systems perfectly. Think of your innate immunity as the general security guard at the front door. It's fast, it's always there, but it kind of treats every threat the same. Your adaptive immunity, though, that's your elite special forces unit. It takes a little longer to deploy, but it learns the enemy's face, creates a highly specific plan, and remembers that enemy forever.
And that leads right into this. How do we get that immunity? Well, you can either build the army yourself, or you can borrow one. Active immunity, from getting sick or getting a vaccine, is your body doing the hard work to build its own permanent army of antibodies. Passive immunity, like what a baby gets through the placenta, is more like a temporary loan of somebody else's army. It's super helpful, but it doesn't last.
Okay, so we know the players. Now let's talk about the game itself, the actual process. You know, for an infection to really take hold, a very specific sequence of events has to happen, and it unfolds on a pretty predictable timeline. Understanding this is everything when it comes to stopping it.
This right here, this is everything. Seriously, memorize this chain. As a nurse, your entire job in infection control boils down to one thing: finding a weak link in this chain and breaking it. If you can wash your hands to stop transmission or put on a mask to block a portal of entry, if you break just one of these 6 links, the infection stops dead in its tracks.
This timeline is also super important. Pay close attention to that prodromal stage. That's the tricky one. The patient just feels a little off, Vague symptoms like feeling tired. But what's happening inside is that the pathogen is multiplying like crazy, and this is often when a person is most contagious, even before they have any idea what they're sick with.
So we know the process, but how do we actually spot an infection in a real live patient? Let's dig into the clues the body gives us, both the ones you can see and the ones you find in the lab work.
This is a classic nursing school comparison, and you'll see it every single day in practice. Localized means the fight is happening in one specific spot. Think of an infected paper cut. You'll see all those classic signs right there. But systemic, that means the infection has gone mainstream, it's body-wide. And that's when you see those generalized things like fever, chills, and fatigue, because the whole body is now involved in the fight.
NCLEX alarm, if you're going to memorize one lab value from this whole explainer, this is it. When you see a patient's white blood cell count, their WBC, creep up over 10,000, your internal infection alarm bells should be screaming. It's one of the clearest signs that the body has deployed its cellular army to fight something off. And this is what's happening on a micro level during that localized response. It's a beautiful 3-act play. Stage 1, you get the redness and swelling. Stage 2 is the battle itself, where you see the aftermath, the exudate or pus. And Stage 3 is the cleanup and repair, where scar tissue comes in. Understanding this helps you look at a wound and know exactly what's going on.
All right, enough with the theory. Let's get into the practical hands-on stuff. This is how we actually stop infections from spreading. This is your day-to-day infection control playbook.
Okay, screenshot this slide. Print it out, tattoo it on your arm. Well, maybe don't do that, but seriously, this table is pure gold. It lays out exactly when to use airborne, droplet, or contact precautions, what PPE you need, and the big hitter diseases for each. Know this table inside and out. It's non-negotiable for your exams and for keeping everyone safe.
Okay, let's switch gears and talk about how this stuff is actually going to show up on your exams.
The NCLEX isn't just going to ask you to spit back facts, it's going to make you use those facts to make clinical judgments. Here's a pro tip for you, a little memory anchor that is a lifesaver. For airborne precautions, just think, my chicken has TB. That stands for measles, chickenpox, which is varicella, herpes zoster, which is shingles, and tuberculosis. Trust me, having a mnemonic like that in your back pocket under pressure is a game changer. So, what do you think? The answer is droplet. And why? It all comes down to the size of the particles. Airborne germs, like from TB, are teeny tiny and can float around in the air for hours. Droplets from something like pertussis are bigger and heavier, so they fall to the ground pretty quickly, usually within about 3 to 6 feet. That distinction is critical.
This is probably the most important safety principle of all. Standard precautions are your baseline. You use them for every single patient, every single time. You have to treat everyone as potentially infectious. It's what protects you, and it's what protects all your other patients. It's the foundation of everything.
Okay, you've taken in a ton of information. Now it's time to put it all together and apply it. I'm going to give you a clinical scenario, and as I'm reading it, I want you to start thinking like a nurse. What are the clues? What do you do next?
Okay, the second you hear that report, your nurse brain should be firing on all cylinders. We've got some obvious red flags. Older adult, fever, that nasty cough. But the real kicker here? The confusion. This is a huge clinical pearl. In older adults, the first sign of an infection is often a change in mental status, not the classic fever or cough. That new onset confusion is a major clue that something is wrong.